Thank you, Chairman. I'm delighted to consider Assistant Administrator McCarthy's nomination to serve as the Administrator of the Environmental Protection Agency. 4 years ago, when EPW assembled for Lisa Jackson's nomination hearing, I expressed my frustration that the EPA, during the Bush administration, had become a poster child of the opaque federal agency pandering to special interests rather than one that based its decisions on the best available science and on the public interest. As the Assistant Administrator of one of EPA's most active divisions, Air and Radiation, Ms. McCarthy has played an instrumental role in helping to turn the EPA around. During her exemplary career in public service, she has designed and implemented policies that have saved countless lives and billions of dollars in health care costs. Ms. McCarthy began her career as health agent for the town of Canton, Massachusetts in 1980 and has worked her way up ever since. During 33 years of public service, she's also been Deputy Secretary of Policy for the Massachusetts Office for Commonwealth Development and Commissioner for the Connecticut Department of Environmental Protection. She's served both Democratic and Republican governors, including Mitt Romney and Jody Rell. One of her many accomplishments in New England is the Regional Greenhouse Gas Initiative, RGGI, the first of its kind market-based effort to reduce greenhouse gas emission in the Northeast and Mid-Atlantic. Currently, RGGI has 9 member states with a combined population of 41 million Americans. RGGI has been credited with boosting local economies by sparking further investment in energy efficiency programs and renewable energy development. She brings New England values of plain-spokenness, independence, and practicality. And her local experience makes her well aware of how federal policy affects local stakeholders. As Assistant Administrator, Ms. McCarthy crafted several key health standards, including the first ever mercury standard for power plants. The mercury and air toxic standard set long overdue standards on mercury, arsenic, chromium, sulfur dioxide, nitrogen oxides, and other dangerous air pollutants. MATS, as it's called, is projected to prevent up to 11,000 premature deaths, 4,700 heart attacks, 130,000 asthma attacks, and to provide as much as $90 billion in health benefits each year. That's $3 to $9 in health benefits for every dollar spent to meet the standard, a huge economic win. I'm from the Ocean State. I know that cleaning up smokestack emissions is one of the most important things to do to reduce toxic mercury compounds that build up in our fish and enter our food. Rhode Island and other states along the eastern seaboard are also downwind states, downwind of tall smokestacks spewing pollution. As of 2010, 284 tall smokestacks, stacks over 500 feet, were operating in the United States. Needles injecting poison into the atmosphere and contributing significantly to pollution in my home state. The air pollution from these tall stacks went largely unchecked until Ms. McCarthy came along to clean them up. These same smokestacks have been unloading their soot pollution on Rhode Island for decades. Last December, EPA adopted a stricter limit on soot, or as it calls it, fine particulate matter. When we breathe it in, soot increases the risk of asthma attacks and lung cancer. The smallest particles pass into the bloodstream and cause heart disease, stroke, and reproductive complications. Restrictions on particulate matter are expected to prevent as many as 35,000 premature deaths every year, 1.4 million asthma attacks, 2.7 million days of missed work or school, and save between $2 and $6 billion in avoided health care costs. Another huge economic win, if you're not the polluter, of course. Then, yes, you do have to clean up your mess. The costs of air pollution are paid in premature deaths and reduced quality of life, higher medical bills, strained public health services, and missed days of work and school. Asthma is the #1 health reason for missed school days and the 4th leading cause of missed adult work days. My downwind home state of Rhode Island has the 6th highest rate of asthma in the country. More than 11% of the people in my state suffer from this chronic disease. In 2009, 1,750 Rhode Islanders were hospitalized for asthma. Hospital stays that cost about $8 million, not counting medication and missed days of work and school. So the return on investment from EPA's air standards would make a hedge fund proud, and I am proud to thank Ms. McCarthy for these successes and to support her candidacy as Administrator of the Environmental Protection Administration. Thank you very much, Madam Chair.